afternoon, everyone. My microphone is working. Yes, it is. Had to hit the button there. Welcome. My name is Peter Berman. I'm the director of the School of Population and Public Health here at UBC. And I want to welcome you all to this, our 7th Voices in Health seminar this year, which we are so delighted to be co-hosting with the UBC School of Public Policy and Global Affairs. And I just want to note a little plug for a growing interest in collaboration between our two schools, including some joint faculty recruitment and all kinds of other great ideas we have for the future. I want to thank the SPPGA team for co-hosting this event with us. Let me begin with acknowledging that our event takes place on the traditional, ancestral, and unceded indigenous territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And as always, we're very grateful for the opportunity we have to work in this beautiful place on these wonderful lands, and appreciate that very much. I want to take a note to mention that we are live streaming to a wider public community through our YouTube live link. And so we welcome our online listeners, and there will be an opportunity for them to transmit questions through that link, which we will try to pass on to our moderator. Our topic today, COVID-19, contextualizing the scientific, political, societal, and economic impact. I don't think I need to say that this is very timely, and I have to say that as a relatively new citizen resident of British Columbia, and I have been definitely appreciating both the approach that we've been experiencing here in British Columbia, but also feeling all around us the energy and concern and stress increasing. And maybe this is a moment for us to take a deep breath and do what we do well here at the university. We can all go home and worry later, but let's spend a few minutes learning from each other and thinking about the meaning of what we're experiencing and maybe experiencing in the coming months together. This is a panel discussion. Our moderator is Peter Klein, Executive Director of the Global Reporting Center and Professor at the UBC School of Journalism. I want to remind the panelists, please, to speak close to the microphone because that's needed for the audience online to hear the proceedings and so on. And so let me pass on the microphone to Peter Klein. Thank you very much.
Thank you. So I'm just going to take a few minutes to give a little bit of context of
we're going to try and get rid of the sound.
Yeah. Sorry. I'll take a few minutes to give a little bit of context to what we're going to be talking about. I'm going to hand it over to the panelists who will open the questions both in the room and streaming. The other day, the comedian John Oliver joked that coronavirus is how the common cold describes itself on its resume. And there's a lot of nuance to that joke, of course. The coronavirus is often the source of common colds, relatively innocuous common colds, but this is a new kind of virus that has emerged, and there's a lot of confusion, there's a lot of ambiguity, a lot of misinformation around it, and we're hoping to try to address some of that today. The WHO gave us a little bit of clarity today by declaring COVID-19 a pandemic, something they don't do very often. The last one was H1N1 in 2009, which killed 18,000 people in 140 countries and territories around the world. Before that, 1918, the Spanish flu killed anywhere between 17 and 50 million people. Some of the panelists may have opinions on the numbers, but there's a lot of people. Some of that confusion is caused probably by politicians. A lot of it is caused by journalists, so I don't know how they got me the journalists to maybe they want me to balance out the great harm that other journalists have done. This outbreak was started in China, in Wuhan. Government and public health authorities moved very slowly at the beginning. They were quite secretive. Some people have called this China's Chernobyl. That we'll look back on this as a kind of a slow-moving disaster that the government didn't deal with very well at the beginning. They seem to be doing relatively well today and are in the process of containing the outbreak in China, but of course it's gone well beyond its borders. In the United States, a person has been put in charge of the COVID-19 response who has publicly said smoking doesn't kill, condoms are poor protection against disease, and the best way to combat HIV is through prayer. So I'm not quite sure how things are going in there. But Congressman from my home state of Florida, Matt Gaetz, recently wore a kind of ridiculous giant face mask to the floor of Congress as they were talking about allocating funds, emergency funding to deal with COVID-19, to sort of ridicule the overreaction. He has been quarantined for 14 days because of exposure to COVID-19 at a conservative political action committee. So maybe there's some justice. In Iran, where there's another big cluster of cases, there's enormous mistrust. There was recently a politician who went on the news shows and was coughing and was saying, I've been diagnosed with COVID-19, and lots of people in Iran are suspicious that he's going to come back the next day and be totally healthy, as kind of a spin to say, look, it's not a big deal. The lack of information just recently led to 27 deaths in Iran, not from COVID-19, but from drinking alcohol. Of course, food-grade alcohol is largely unavailable and banned in Iran, so people were drinking industrial alcohol, which was not denatured, and they died. Bad policies, bad journalism can lead to deaths, clearly. There were early rumors that this was a weapon of mass destruction, a biological weapon. There is a prominent virology research center in Wuhan, which led to some rumors, and of course the disproportionate number of cases in Iran have led to rumors that conspiracies that this was a weapon of mass destruction. By all accounts, it's not. The Guardian mistakenly wrote the other day that a good way to protect yourself against COVID-19 is to mix ethanol, hydrogen peroxide, and bleach. I don't know if there are any chemists in the room, but if you do that, you will release chlorine gas, which is poisonous, hydrochloric acid, and chloroform. Of course, they went back and corrected this. We meant or. You can use either of these three, but small words can lead to harm. In any case, to address this crisis, we need a multi-tiered approach. We need physicians, public health officials, policy experts, economists, global policy people who understand a broad range of areas, and we're very, very lucky to have that here. I'm going to briefly introduce each of them. I can go on for minutes at a time on their resumes, but I'll just very briefly tell you who each of the panelists are. We're going to turn it over to them. They're going to give their perspective on the crisis for a few minutes. Each one I'll facilitate a conversation, and then we'll open it up to all of you. Dr. David Patrick is an infectious disease specialist and epidemiologist with career interest in emerging infectious diseases. His current focus is on broad efforts to contain the threat of antimicrobial resistance in Canada, so I'm really curious what you think about all of our sessions with Purell. He's an associate professor at the School of Population and Public Health. He has a medical degree from the University of Ottawa. Dr. Srinivas Murthy is a physician board certified in pediatric critical care and pediatric infectious diseases. His interest is in innovative clinical trials and international collaborations, and he's currently an investigator at BC Children's Hospital. Professor Kelly Lee is Director of Global Health and Associate Dean of Research at Simon Fraser University, trained in international relations and public administration with a focus on international political economy. She spent more than 20 years at the London School of Hygiene and Tropical Medicine, where she remains professor of global health policy, analyzing the role of UN in health, and has worked extensively with the WHO throughout her career. And Professor Pittman Potter is a professor of law and director of Chinese legal studies at the Allen School of Law here at UBC. Teaches and focuses on the People's Republic of China and Taiwan law and policy areas of foreign trade and investment, dispute resolution, property law, contracts, business regulation, and human rights. Published more than 100 articles and essays in several books, including The Legal System of the People's Republic of China and Assessing Treaty Performances in China, Trade, and Human Rights. And he'll be able to give us a bit of the context, the Chinese context. So with all that, I will hand it off to to Dave to give an overview from his perspective.
So I thought I'd give you a bit of an overview just in terms of what this virus is and how we look at it from an epidemiological point of view. As Peter said, coronaviruses are not new entirely to humans. They cause common colds, and sometimes they cause serious infections in long-term care facilities. We had that in 2003 after SARS. We had a reference lab telling us we had SARS again, but we didn't actually. It was that reference lab made a mistake. But those coronaviruses are around, and once in a while they can be serious. But 3 times this millennium, we've seen a novel coronavirus. And when we mean novel, we mean not new to the bats, that it's probably the original reservoir, but new to humans, passed over to humans either directly from bats or through another mammalian reservoir. The problem with a novel new coronavirus in humans is, number one, we have no immunity in the population. We've not met it before. There's no herd immunity to invoke to shut down its transmission. So if it's transmissible enough, it can get around. Number two, we don't usually have a vaccine available, and we're not likely to have one for maybe 12 to 18 months, even if all things go right with the development. And number three, unless we're able to repurpose old drugs, we may not have drugs that actually are effective either, and Dr. Murphy will talk about his ideas on that. So in 2003, of course, we had SARS. This came from bats by way of civet cats in one of those wet markets in southern China and over to humans. SARS killed 1 in 10 humans that it infected, but it eventually could be shut down by infection control because by and large it wasn't super duper infectious outside of particular settings. In the intervening years in the Arabian Peninsula, we've seen MERS. It's moved from bats through camels and periodically gives people a serious infection, and that kills 25% of people that it infects, roughly. COVID-19 probably emerged late last year. We know the story of the city of Wuhan, Hubei, the probable role of wet markets again. They'd actually disappeared after SARS in China, and then the regulation had failed and they'd come back in. So what the intermediate vertebrate host was is academic at the moment, back to something to human is what happened. And the real question with this one is it seems to be more transmissible. Now, you've learned a bit about transmissibility in the news lately. If you're a human and you're talking about reproductive success, you want to say, okay, I get together with somebody of the opposite biological sex. I have 2.2 kids, and enough for my genes to have a fighting chance in the future. For a microbe that doesn't have sex, it's different. Every infection has to start at least one other infection. And that's the case reproduction number, or the R naught that you've read about in the newspapers. The issue with this virus is that in its natural state, that R naught may be 2, 2.5, which is plenty to cause an epidemic. And that means that it's able to get around all other things being equal. But it's important to remember that what makes up the R naught is some of the biological characteristics of the virus and how infectious it can be. But an awful lot of it is how we humans come into contact with each other, what our behaviors are that can affect things. All of this is the advice that you've been given and the measures that public health are taking into account. And by all accounts, it seems possible to drop R naught for this virus with extreme measures down below 1, which is enough in certain areas to drive it back into nature. The real question is, how difficult it is to sustain those efforts over the long time. So it's actually up to us, to a certain extent, how transmissible this virus is. The public health response in BC, as you know, we had very quick action by the reference lab, led by Mel Cratchton from pathology. And they had, within 3 days of the sequence being published, they had a working PCR test for the virus, which was quite good. But all of these efforts around identification of infected people and isolation are meant to reduce that contact rate and that functional R naught, and they're continuing, even though we've had some challenges in recent days. The importance of bringing that reproductive number down is this. Many of you have seen epidemic curves. And when you have a large R naught and a short incubation period like with this virus, it gets very steep, large number of cases day by day, and then it'll come crashing down sometime later. If you have a smaller R naught, good public health measures, then that's a much more protracted, slow epidemic curve. Still a problem, But think about it in terms of managing sick people. If we can flatten that curve collectively, we can make it a more manageable problem for our healthcare system if we do see sick people in the community. And that is very much the objective of the public health effort, making it more manageable. In addition, it buys us time so that more people can benefit from vaccine when it's produced or drugs when they're proven to work. So we're very much in that kind of containment mode right now. So I just, don't want to speak for too long, but I'd just like to remind you about the advice to you. I'll put it this way. You got fever or cough, take a week off. If you need to cough or sneeze, use a tissue or your sleeve. If you don't want to mess up your plans, then wash your hands. And once you know what to do, protect your seniors too.
David, I expect to see that on YouTube with a beat behind it.
Well, Korea actually put an amazing video together. It's gone viral.
I've seen the Thai video. The Thai public behind the video is quite excellent. I'm going to talk about the individual within this outbreak, and the individual meaning the infected patient, because we're talking about preventive strategies. We all obviously don't want to get this infection, but 100,000 people around the world have thus far, and some proportion, depending on which numbers we look at, have died. And we still don't know much about what this disease causes in humans, despite that number of people in the 3 months of experience we've had. We don't know why they are dying, and we don't know what exactly they're dying from. I was on a call about 2 hours ago with some colleagues in northern Italy, who I'm sure you've heard are struggling to contain the virus and to manage their health system, which has strained and arguably has broken, in their words. They're unable to have patients arrive in their emergency rooms. Their ICUs are full, and they are excavating, which means separating from ventilation. Patients who are not ready for that, but they need to move them along, with the acknowledgement that that's likely a fatal thing. And that's not something a developed or sort of a first world country has typically done in the past 50 years of medicine. So this is uncharted territory in terms of a clinical diagnostic tree and a clinical management tree for all of us to figure out. And we're trying our best in terms of answering these questions as to what the disease is and how best to manage it. But these lessons are hard to learn, especially in the context of the stress involved with the providers who are treating these patients. Performing research or answering good clinical questions is very difficult in that context. You can imagine if you are a patient and you're with this infection and someone asks you if you would like a medication that may work or if you would like a placebo. And would you be willing to randomize yourself to that? How many people in this room would accept that trial? Raise your hands. So I see about 5 people in this room out of about 100, meaning that most of you would want, no, I want the medication. I don't care if it works. I don't care if there's safety data that's out there that shows that it's effective, but I want it. And that's different than almost all of the other clinical research that we perform in medicine, where there's equipoise, which is we don't know what's right and what's wrong, and we hope to get an answer by randomizing or assigning people to one group or another randomly. In this context, with this stress and anxiety that's around this disease, people are uncomfortable by that. Justifiably or not, and that's a conversation that we can have with individuals and the public. And there's that. There's the vaccine. As Dave mentioned, doing a trial of that vaccine will be very difficult to do. And once it's available, how do we distribute it in an equitable way, given the costs that will be attached to both developing and producing it at a scale that's required to reduce this infectious burden. I think all of these questions remain unanswered by the global community, and it's still a struggle. I'll stop there.
Is that me? Oh. Right, so that's a great start. We've heard a little bit about the pathogen, we've heard about individual and clinical management. The piece of the picture that I bring is looking at collective action. So understanding that these risks are risks that we need to deal with collectively as a society and as a society of countries. So the first half of my career I spent looking at health risks that are increasing as a result of the interconnectedness of our world. And so I spent quite a lot of time just convincing people that that was the case, and the last 15 years trying to figure out, okay, what do we do about this? What are the institutions that we need, both at the local level, from our local level all the way up to the global level. And what I've learned is that there's a lot of expectations, certainly a lot when the outbreak occurred. It was interesting that the number of questions I was asked about what did I think about WHO, what did I think about its authority, did it act fast enough, and all sorts of questions. And it told me that people probably didn't really understand what the authority and what resources WHO actually has that we've given it. And it showed that perhaps there was this disconnect between our world as we have it today and the institutions that we still need to build. WHO was created after the Second World War, as we know, as part of the United Nations system. And it was a system of international states systems, so it was built around government. We have a very different world today. We're living in a very interconnected and mobile world, and the institutions, in my mind, haven't adapted. So we're seeing that. And the other thing that I'm interested in is the political role of governments, of leaders, and the role they play as they interact with public health authorities and experts. So we see, good examples and bad examples at the moment. And so what do we want from our politicians at this time? What do we need from our leaders? And what kind of political institutions do we need to make sure that we're working collectively together and not individually? So our grant that we just got was to look at international health regulations and compliance or non-compliance with those regulations. You may know that WHO issued a recommendation that countries not adopt travel restrictions. Within hours, many countries did. So that was a sign that either they didn't trust WHO's recommendations or didn't believe them, or maybe they just thought that they knew better. So we're interested in why that's the case, why so many countries have adopted these measures. And our data shows that actually this outbreak, there's been more measures like this adopted than other public health emergencies that we've had. So that's quite unprecedented. So we're hopefully understanding that, helping decision makers under a lot of pressure to make better decisions that are based on evidence and not on fear, political pressure, discrimination, whatever. We want to make sure that that decision makers are making these really fundamental decisions that actually allow us to work collectively across countries can do so with the best evidence.
Thank you. I appreciate the opportunity to share some thoughts with you. Today I'm going to focus on lessons from China's handling of the COVID-19 in 4 areas: handling of information, the internal socioeconomic dimensions of the crisis, the effectiveness of China's responses, and lessons for the next phases. So everyone's been reading the newspapers. We're all pretty familiar with the problem of information management in the early stages. Access to information was lacking. Doctors were punished for doing what their administrative responsibility said they had to do, which is to report a disease like this. And we saw an eerie repetition of China's behavior in the HIV/AIDS crisis of late 90s, early 2000s, and the SARS crisis. In fact, as I was thinking about this, I went back to some of my old files because I was doing work on it before, and it's just eerily familiar. And this certainly had an effect on the virus's early spread and the escape. So one of the lessons is the information needs to be more transparent, more readily available, and political restraints on communication should be discouraged. Another element is that the internal dimensions, which are often not appreciated. So there's a gender dimension to this, which is often not commented on. Women are only slightly less prone to being infected, but the domestic violence rate in China has spiked in recent months, and it's a little early to tell exactly why, but the confining of people in close quarters for long periods of time certainly seems to be contributing to that. There's a class dimension, for example, the impact on migrant workers of orders not to work means that they cannot survive. They are not part of the health insurance system, they're not part of the wage replacement system, and so there's been a disproportionate impact on them. There's an age question. According to China CDC, people aged 19 or less, there's only a 2% infection rate. So youth are asking the question, why put millions of dollars, this is an opportunity cost question, why put millions of dollars into dealing with a disease that affects older people as opposed to putting it into things like climate change, which are of much greater direct relevance to youth. So there's an age dimension to that. And finally, there's an ethnicity dimension. We've already seen in our communities racist attacks on people displaying what some would consider Asian features. I'm not even sure what that means, but the attacks are real. And in China, there's been a spike in the prison in the infections in the prison population, and that leads us all to think about the situation in the detainment camps in Xinjiang, which I assure you are not about vocational training. They're really about confinement, and there's an ethnic dimension there. So there's 4 internal dimensions of gender, class, age, and ethnicity that really need to be attended to more directly. So when we look at China's responses, China does what China does best: control information and control people. And that's what they've done. I recently just exchanged emails with people in Wuhan, and I have other friends in China that are suffering these lockdowns for 45 and 50 days or more, and it takes a toll. But they have been effective in locking the situation down, and also economic intervention. The rate, frequency, and amount of special purpose bonds being issued by provincial governments has spiked in the last 2 months as they try to raise money for projects that will try to offset the economic impacts. Central subsidies are not yet a major part of the plan, but they are coming. So there's the political intervention and economic intervention, and we have to ask the question about the effectiveness. I think it's very important to recognize that if you look at the social media in China, there's a great deal of hostility toward the central government, and Xi Jinping has taken a lot of criticism, but so have others in the response, and also the legal effectiveness, the regulation on wet markets, for example. There was a series of regulations on infectious disease that came out after the SARS crisis, and these either were enforced that led to a clampdown or ignored, which led to clampdown. So those are issues. So we have to ask about the sustainability of China's measures and whether they have been responsive to the internal dimensions. The lockdown has, by many accounts, contributed to domestic violence, and the subsidies and local bonds, the question is whether they're really addressing the issues of concern to women with respect to this crisis. In the class dimension, lockdown impacts on wage workers without sick leave. I just want to stress you've got 60 million or more migrant workers in China that are not attached to what used to be called a hukou system, are not locally registered, and it's very hard for the government to actually reach them in terms of suppressing their movement, to test them, and there's already work on getting the factories back in order. Those people are going to come back, and that is a potential danger sign, so that's a question about the control dimension. The effects of lockdown on education, the age question, where people are not able to go to school, and the completion of their final high school years, what have you, are being affected. And then the ethnicity issue about whether the clampdown with regard to Xinjiang detention camps or elsewhere is actually having a disproportionate impact by ethnicity. So when we think about those 4 internal dimensions and we think of China's responses, we need to ask questions about what sort of works. So the key questions for us in Canada, and China is a good place to look for this, is what comes next? As we move from containment to mitigation, which we will do the containment strategy work when we're talking about mitigation? And if not, what happens? And then ultimately, in a good news situation where we have in 12 to 18 months we have a vaccine and we move to something resembling a new normal, how do these control mechanisms and mitigation mechanisms persist? And I think it's fair to say, as a student of comparative politics at the Max City here, but governments that seize control over activities because of a crisis, and I'm thinking of the mayor of Chicago, of a crisis, are loath to give them up. So I'm not holding my breath that China's control mechanisms, which are sharpened, everybody has a cell phone that has to be registered, they're in the infected zone, I'm not sure they're going to give that up. And then that makes us think about what is going to be the new normal. So the lessons for other countries are, how do we learn from the Chinese example? How do we build sustainable responses in the transition to mitigation and back to a new normal? How do we manage those internal dimensions? and how do we manage these transitions. And I would say just the last point is, what we've seen in the last month is countries falling back to the default system of governance. China is control information and people, and they've done it. They've done it very well, and WHO commended them on their containment effectiveness. Japan, it's been a largely bureaucratic response. So the Diamond Princess was held up because of bureaucratic concerns over whether they could process the immigration papers for the people on the boat. And that's the default bureaucratic position of Japan. In the United States, the conflict between the President of the United States and his expert advisors, which we've seen in national security, environmental protection, and economic policy, we are now seeing here as well, resulting in general policy paralysis. So actually, Canada looks really good to me. I mean, on a panel may disagree, but I think Von Henry will be nominated for a Nobel Prize in medicine. I mean, I think that the work has been done largely because people were prepared. They had a pandemic response plan, which other countries don't seem to have. So those are some of the lessons that we take from China, and it's not about blaming and shaming, and it's not saying one is better than another. It's about learning lessons from the objective reality of China's responses.
Thank you. Well, it's a good place to jump off in terms of Canada's response. Canada, it was prepared to some extent because of SARS, because of course SARS it was not handled terribly well. But I think a question that a lot of people have, so it's more a question probably to the physicians on the panels. Yes, pandemics are not new. I mean, obviously we've had the Spanish flu, but we've had smallpox, we've had plenty of major health crises around the world. But it does seem like there have been a disproportionate number in the last decade or two, whether it's bird flu, swine flu, Nipah, MERS, SARS, and then COVID-19. Why are these more common these days? If so, why are we seeing them? And is there kind of a sweet spot for not so much virulence, but the spreadability of these? You look at something like H5N1, it was quite deadly, so it actually helped it contain. I mean, this one is almost largely asymptomatic at the beginning, so people are spreading it. Do we have a real crisis ahead of us?
Maybe I'll start just with talking about this, in terms of natural selection, really. We are 8 billion humans on planet Earth. It's a lot of biomass. It's food for something, ultimately. So what you do have to think about is we get a little bit more crowded. We have much more of an interface with parts of nature that should be left alone. And we do get exposed to more of these pathogens. The other issue is that if you take a look at how mobile humans are, even over the last 3 decades, it's gone up dramatically from where we were, say, in the 70s or the 80s. And that means that if we do get a new pathogen into the human population, its potential to go global is that much larger. So I think that's something we really have to consider. Peter, in terms of your specific question around this one seems mild in some cases, I do really want to sort of correct the impression. A lot of people have said, well, this isn't a lot worse than a seasonal flu. It is. The fatality rate may well be low, may well be 1-2%, maybe even be a little lower than published because maybe it's getting around. But that's considerably more than what we see with seasonal flu. So we certainly do with pandemic flu. So what we certainly don't want to do is see this virus get around the planet in the sort of numbers that we saw with pandemic flu or that we see with seasonal flu, because that would keep people who run intensive care units like Dr. Murthy very busy.
And just to add, is this more frequent now? And I'd say yes. Is this our new normal, that every few years there will be a major outbreak of something? It's impossible to say. But looking back over the past 2 decades, it appears that there's some periodicity that's concerning.
I should add, though, that compared to 2003 with SARS, this is probably more common, and our ability to detect these problems and characterize them has moved ahead in leaps and bounds in just a decade and a half. So when Mark O'Mara and Bob Brunham had looked to sequence the SARS virus, and that was done at UBC in BC, person in the world in 2003, they diverted a whole bunch of people off cancer research and genomics and stuff for a period of time in order to get that up and done. That work can now be done with one sequencer in one afternoon. And our ability to characterize newly emerging pathogens, and that's been important. When that sequence went up, it was possible for every lab around the world to begin to gear up to test for the virus.
And I just wanted to jump in and emphasize, I think support what David said about severity of this outbreak. We don't know yet. I mean, what's interesting as I saw today, it depends on this curve that you described so well, David. If we have this upward curve, sharp upwards, we're going to see a much higher case fatality rate because health systems are overloaded and we won't be able to cope. So, and also you're pushing out a lot of people that actually generally use the health system, and they'll also suffer from that sort of surge. If we keep the curve flatter, the data seems to show that we'll have a lower case fatality rate. So it feels like a tsunami that's coming, right? And we're asking to prepare. We can prepare so much because we only have so much capacity. I think it's nice that, I enjoy that, I like that the Canadian government has been very measured in its response, but I don't think we've been tested yet. We have to look at countries that have had this outbreak in a severe way or prevented it, and I would say the Asian countries like Taiwan, Singapore, Hong Kong, even South Korea. We need to look at them and how they've responded. I agree that the Chinese response has been questionable in some ways, but at the same time, they've bought us a lot of time. And we need to look to them, and I don't think we can be complacent at this point.
Well, Kelly, you said that the WHO had actually recommended not having travel bans, but they've been largely ignored. Can you explain why they recommended that, and what's your thoughts on the response? Has it been overdone, the response, or underdone, or the right space?
Yeah, great question. The evidence really shows from previous pandemics, from other outbreaks, that if you institute travel bans, restrictions, and you start to stigmatize people, you tend not to get the information you need to actually track cases. People start to go, they start to fudge the information, or they don't even report themselves because they're fearful. And so what you're not getting is that full information. And we see these little pockets of outbreaks that's happened under COVID, and people are going, oh, why, how did that happen? Where did that come from? Well, people have moved, but they haven't reported the information. So, of course, it didn't just pop up. Somebody has gone to Iran, or somebody has gone to California, and they just maybe not have fully disclosed that they've been in various places. So this is the risk, is that you don't want to push people underground. You want to encourage people to be as fulsome as possible with the information. And this has been proven time and again. Has the response been appropriate? I think they called it at the right time. I might be unpopular in saying that. I think the public health emergency on January 30th was right. WHO can declare it was calling on the world to take this seriously and to put resources behind it. And then there was crickets. It felt like we're waiting for this information to come, but then the resources to fight it was very slow to come. I was worried about that because what do we want from WHO? Well, we want it to go in as a SWAT team and just go into countries and do what we expect our public health agencies to do. Well, then we should be given that authority, but it doesn't have that authority. It doesn't have those resources. So it's done what we have allowed it to do, and that's fair enough, I think.
I think Pitt was going to say something quickly.
I just want to say a quick thing on this, and I say to people all the time, it's not the thing, it's how we respond to the thing that counts. If we're looking about how our society is going to be transformed by this, we have to think how we're going to respond to it, and others have contributed to that. But government responses tend to fall along the spectrum between control and sort of informed empowerment. And I think Canada's more at the inform people and empower them to make decisions in their own interest. But to that end, and not to take a page from Pence or the rest of those folks down there, but it may not be prayer, but I think informed reflection would be a really good thing for people in the society, so that when people hear a neighbor got sick, or they hear a co-worker got sick, or a community that is, a condo born, that their response is intentional, and they think carefully about where they fall on that spectrum between control and informed empowerment, and engage in a bit of informed reflection.
I just wanted to add one thing, sort of this WHO thing. As you know, WHO sent a newfie to China. That was Bruce Aylward, who was a colleague of mine. He did an internship with me years ago. And Bruce came back from China characterizing sort of two aspects to the Chinese response, and I think it's an important nuance. Yeah, people probably got off the ground slowly in Wuhan and Hubei, but Bruce noted that in every other province and territory of China where cases were exported, there was not a long chain of propagated transmission. In other words, things managed to get shut down pretty well there. You can question whether the information is always fully evident, but it is important to say that, like in Singapore, like elsewhere, there was a distinct effort, which appears to have been successful, to shut down the regional transmission in other provinces and territories of the People's Republic of China.
And you can see that directly in the case fatality proportions in regions of China, where in Hubei province it's much higher, arguably 7 to 8-fold higher than outside of Hubei province. And so from that perspective, China's response is not just one thing, it's a multitude of things.
You know, in a place like South Korea, I think there's some kind of self-reflection, criticism of how they handled things. Patient 31 who came in from Wuhan and reported that she had a fever. They kept saying, you should be tested. She's like, no, it's fine. And she went around, kept going around, went to a church. There's, hundreds of cases that have been tied directly to her. She was a super spreader because they didn't kind of come in with this draconian response.
Where are you going? I'd like to stop use of that term, super spreader, sort of a stigmatized.
Yeah. So in that, kind of following up on that, something that we chatted about yesterday when we touched base, and I think Pippin actually touched on it, like what kind of society do we want to come out of this? Maybe you mentioned this, but Fargo Maju in the New York Times today had a piece that says everyone's a socialist in a pandemic. All these people who were against sick leave and any kind of socialized medicine, all of a sudden are like huge proponents of this for the time being. But I mean, this is kind of a social test on society, a stress test on society. We've seen the largest drop in oil prices since 1991. In the Gulf War, 2,000-point drop in the Dow the other day. Conferences all over the world are canceled. We've had obviously huge commercial impact from the various global curtailments. What is this an opportunity for us to kind of reflect on what we are as a society, what we want to do, or is it going to be a power grab? I mean, a lot of countries are, both localities and on national level, are exerting power in a way that they rarely do. The entire country of Italy is shut down. I mean, that's pretty draconian measure. And one thing we know, looking back historically, is that when politicians get power, they don't like to let go of their power. So where do you see us a year from now, when this is passed? Where do you see us as a society? What have we learned from? What will we learn from this?
Well, I can start. My thought is we don't know, and that's the challenge. I mean, there we are at the beginning of this. I said the other day that this may pass in a month, and we'll remember the Bruce Springsteen lyric. Someday we'll look back on this and it'll all seem funny, but it doesn't seem like that's going to happen. It seems like it's going to get worse and worse and worse. And where we end up is still uncertain. And that's why I think it's so important to empower people and communities to be knowledgeable, to be informed, to be educated about this. So when some political leader says, well, the only response to this is to lock everybody up or close everything down or whatever, that there's some pushback on that. Because we have to ask ourselves the question, what is the society we want to live in? And at what point, how many percent below optimal control are we willing to, or would we be willing to accept in order to increase our civil liberties and a way of life? And I don't know the answer to that, but I think what we need to do is to start thinking in those terms so that we look at the social indicators of health, for example, and those sorts of issues which many people more learned than I am talk about. But I think it is that conscious, intentional reflection on what is this going to do to our society, and maybe as we move from the containment phase to other phases, that'll give us maybe the space and the opportunity to do that. But I think it is really, really necessary.
I'd like to think, at least in the Canadian context, that I don't know that this brings us a permanent structural change to civil society in Canada. I hope that we remain a learning, thoughtful, calm culture in the face of this kind of thing. And when we take a look at the political responses that we've had in this country to date, to hear that we haven't fully been tested yet, I think they've been measured, responsible, and studied. And it's been kind of actually fun working with the Minister of Health here in BC, and I'm pretty sure he doesn't want to become Health Minister for life like we might see people in other countries move things on. But again, a studied approach where you're trying to listen to what the facts are, entertain thoughts from the experts, solve problems, and push resources where they need to go. I think we're going to remain Canadian out of this ourselves. I am more concerned about other cultures around the world.
My take on it is that, we have, every country has a sort of social contract with its government, people, its government, and in exchange for maybe, less liberty or some more control, you have more maybe protections, more security, and so on. So each society has to decide what that balance is. So I hesitate to judge other societies and what they feel is the right balance for their society. More broadly, though, what this is going to tell us is that we haven't invested enough in the infrastructure that we need. Yes, we did better after SARS, and we created, the BCCDC and PHAT in Canada, and we've done relatively better than most countries, but a lot of countries haven't, and a lot of the countries that should really support countries that aren't able to do because of capacity, to have the basic capacities under the international health regulations, lab facilities, surveillance systems. It's in our interest that every country has those basic capacities. We haven't invested enough in those capacities worldwide, and that worries me. So I hope we can take lessons away that we need to support countries, not only our own citizens, but countries as our, as our partners as well.
I think that acknowledgement that this is not a Canadian outbreak or a Chinese outbreak or a South Korean outbreak, but it's a global outbreak in that context of truly collaborating across countries, whether it's viral data sharing or IHR type policies or whatever it is, that this is something we all have to do together, that those with resources and capabilities like Canada, because of our experience and who we are in the world, need to share those experiences and obligations and resources with places that do not have those, which are many. And so I think hopefully from this, we can sort of build that into our infrastructure.
But it's such a different response around the world, and there's really a balance between freedom and safety, right? Ultimately, I mean, if we want to be 100% sure that this pandemic ends, lock everyone up in isolation for a month and feed them through a little, lock 8 billion people up in a room. I mean, and you kind of have those draconian responses in some places where entire countries have been quarantined and entire regions have been quarantined. Here we have, this sort of idea of a voluntary. If you've been to one of these countries, we ask you to voluntarily quarantine yourself for 14 days. Where do you see that kind of balance between freedom and safety? Are we at the right place? And given the fact that different countries are dealing with it differently, how do we deal with that differential?
Well, I think it was, Max will correct me, but I think it was Ben Franklin that said, people who are willing to sacrifice their liberty for security can end up with neither. I think that's still words that we might reflect on a little bit. And one of the other issues is context, right? This thing isn't this crisis is not happening in isolation. There is a rising tide of authoritarianism around the world. And that is happening, and it's been happening, and there have been hearings in Ottawa, there have been hearings on Capitol Hill in the States. There is a trend, if you will, or certainly worrisome developments in that direction for very clear material reasons. That the independent, liberal, let people make their own decisions approach, liberal markets, and so on, haven't delivered what people either thought or were induced to think were their due, and therefore the authoritarian is an alternative. And And the difficulty with that is the people who are making those decisions are giving vent to an authoritarian tendency that may have absolutely nothing to do with this disease. It may have nothing to do with the cost benefit of having to handle it. It may have to do with ego, it may have to do with power, it may have to do with all these other things. So I think the task of the professionals is to separate those out a little bit and say, this is a crisis that requires its own particular vernacular and its own particular ways, because there is an undeniable trend toward that authoritarian move around the world, and this can just feed into it unless the professionals help folks understand it.
I think it's important to think about how active governments and public health groups are by phase of an epidemic. I mean, we've not been tested, quite right. We've had a few importations here, not a lot of propagation. If we see a fair amount of community spread in BC, and we're talking about a large number of deaths or hospitals in the same situation as Italy, you can bet that people will be pulling rarely used public health legislation out of the drawer, and there will be requests for people not to gather in large groups, etc. There will be thinking towards whether schools should stay open or closed depending on given severity. We're nowhere near that right now in Canada. And this will be done not by would-be authoritarians, but by people who are just trying to work in the public interest, who are public health professionals, who answer to your elected politicians, none of whom are going to be in office for 3, 4, or 6 terms. They're going to be around and elected. So we've done this in periods of conflict in liberal democracies, and I think we have the mechanisms to do it in periods of pandemic in liberal democracies without necessarily threatening our long-term history. Maybe we're parliamentary democracy and we're lucky that way. Republics can go sideways more easily. Who knows? But in the Canadian context, I can see a lot more authority being exercised for a short period of time, if absolutely necessary. But I don't see a long-term political consequence of that.
Before we open up to questions, I want to ask one last question that I think some people in this room might have, certainly a lot of people on this campus have. We've seen lots of institutions shut down temporarily, including universities, UC Berkeley, Columbia, etc. Long list of universities that have shut down. Some have canceled their semesters altogether. Some have asked students to only take courses online. On this campus at UBC, do you think we've had the correct response so far? Or is our administration doing the right thing, allowing us to continue to gather like we are today?
I think given what we know about transmission in BC, that we're doing the right thing so far. We definitely have a lot of testing going on. We're not seeing a whole raft of cases going on in the general population. I think that there's a lot of benefit to having functions like this and people getting together, and that the general advice about stay home if you're sick, don't forget to wash your hands frequently and stuff, maybe start greeting each other with your elbow, all that kind of stuff makes a bit of sense. The folks at Vancouver Coastal Health who work closely with the people here at UBC have not invoked school closures of any kind within the region. And we'll, of course, be evaluating the course of the epidemic on a regular basis, and if it needs to be revisited, it needs to be revisited.
Great. So let's open up. Question in the back.
Whether deep in the past or in future years, and whether it's an individual or...
Actually, you know what? We're going to hand you a microphone.
Yeah, that'd be great.
So online getting here?
I'm concerned that there's maybe denial or delay, signs of irresponsibility. So whether it's an individual or a whole country that's not responding appropriately, what are the consequences? Underlying that, I guess, is the suspicion that it's not substantiated. Let's say an official somewhere in the epicenter of where it started from complained, and governing bodies said, no, we're going to keep it quiet for a while. That's my concern.
Okay. Yeah. That's a really good question. So, we all have to look to each other to make sure that we act responsibly, but we know that not everybody will do that. On a like a societal level and national level, we have what David described as public health legislation. If necessary, there are enforcement measures. If people are infectious and they won't go into quarantine or isolation, there are unfortunately, we have to call out that legislation. When you move to the international level and a country does not abide by the international health regulations or acts irresponsibly in a way that impacts on other countries, we have more of a problem because there's no enforcement mechanism by WHO. It doesn't have the authority or even the means of punitive sanctions. Unlike, say, the World Trade Organization, if there's a violation of the rules, we can enforce through, monetary sanctions, for example. So, that's something to think about. How do we make sure that countries comply, that they provide the full information, that they adopt measures that are not putting at risk other countries? This is the big gap, and these are the big questions that I try to grapple with in global health governance. We have such an archaic, I guess, system of institutions and mechanisms of authority, rules, and processes that don't fit with what we need today. So you put your finger right on it, you have a big gap.
So one thought on that, and that is that, again, the comments I made before, and my continued thinking is not really concerned about Canada. I'd rather be here than anywhere. But this is Leo is the Global Studies, and this is the global program that is co-sponsoring this thing. So we need to think globally as well as locally. And that's what the concern is. And I think the international global governance challenge, even, forgive me, but even at the WTO, I mean, look what the United States is doing to the appellate process. Without the appellate process is being basically dismantled, which means disputes can't be held in an effective and predictable way, which means all of those sanctioning possibilities are diminished. So I guess I would say maybe this is the good news, that we have been, one of the debates on climate change, for example, is how do we get the global community to do something? And maybe this is the kind of example that hits so close to home that governments may be willing to give up their parochial interests to subscribe to more fulsome global mechanisms. And maybe it takes a global pandemic to do that, and maybe that's the weakness. But more fulsome global approaches, perspectives, analysis, I think is
I want to say one, straightforward epidemiological thing about the root of your question, and that is, the problem of denial. If we do have a reproduction number of 2, then one case gives rise to 2, another one, those 2 give rise to 4, those 4, and so on. We clearly don't want to see denial early on in an epidemic or a disease present because it's quite easy to contain 2, 4, 8, or 16 cases. It's a challenge if we go generations of transmission without tracking, without the effort. It's way harder to put that back in the box.
And I think this speaks to the role of the media and public experts in this discussion, given the engagement required to avoid that denial. And that you need public education for this to be a successful outbreak response. Having a few people at BC CDC is great, but everybody needs to work on this together, and that collectivist approach. So I'll leave it to the journalists and the media experts to help define how to best solve that problem. I think it's partially why we're all here today to have these conversations.
You have a question?
I think my question is for David. In past outbreaks such as this, such as SARS, healthcare workers made up a fairly large proportion of the cases, upwards of 20%, as high as 40 or even higher. Whereas we don't hear much about healthcare worker infection so far in this outbreak. Is that because of reporting and the way people are being tracked, or do you think it's better infection control, such that we've learned from SARS and are better protecting our healthcare workers? Or might it have to do with latency periods and the fact that more people are getting into hospital before they're infectious? Any comments on that?
I'm really glad you brought up healthcare workers. Well, I'll start, and I'm sure Spoon will have something to say about it as well. It's fairly clear that in the Wuhan response in Dubai, there were a good number of healthcare workers who were infected, and as you know, one of the heroes of this epidemic lost his life as a result of workplace infection. All I can say is that there has been a lot of focus on preparation around infection prevention and control. A lot of good reminders going around, and there's a lot of effort going on with the supply chain right now to make sure that there are enough bits of personal protective equipment for people who need it, and including people in frontline medical offices. But I think back to Sren's request that we all take a part in this. The value of that surgical mask out in the community is just about goose egg in terms of helping with this. The value if it's in the hands of your family doc, if he's testing people, he or she are testing people for the virus, or if it's available in the emergency room or in the hospital so that people can be cared for. That's where those pieces of equipment need to be used, and we need to take a collectivist approach to that too.
Yeah, and the one thing that China did provide us is that time for us to map out what these supply chains would look like and map out what our strategies will be at the hospital levels for each of us to protect ourselves from these infections. And so hopefully that trend continues for the rest of this outbreak, knock on wood.
Question back there?
Hi, can everyone hear me? And so I noticed that you folks touched a little bit on the racism, obviously, that this outbreak has brought up. And I was wondering if you could speak to that more, maybe not so much the overt racism of like attack on Asian people and sort of the assumption that they are carriers of the virus, but perhaps more subtle forms of racism that have come up around maybe legislation or the way that the media narratives have been framing the virus, and then how to respond to that. Especially because there are narratives around, some people are like, for example, avoiding Asian-owned businesses as a way to say like, oh, better safe than sorry. So does that make sense? And if not, then how do you push back against that?
At southeast on Trail 4 toward northwest Marine Drive.
I mean, I don't know, okay. As an Asian on the panel, I've had both that direct impact, I have to say, unfortunately, but I understand your question completely. I think we have to stop calling it the Wuhan virus or labeling as such. We have pandemics or outbreaks or novel viruses or pathogens emerging all over the world. And this one happened to catch hold and spread around the world. Yes, there's lots we can do to reduce that risk, but it can happen anywhere. We heard MERS, we heard, we had swine flu and so on from Mexico. The thing is, we really want to avoid terms that stigmatize and blame certain individuals or groups, because that actually undermines the collective action that we need to take. That makes it worse if we start to turn on each other. I had somebody say to me that the outbreak in Seattle was because people of Asian descent went down from Vancouver and was shopping in Seattle, and it spread that way. And that then takes hold, and people are all kind of like, so there's like this fear, which then turns into, I don't know, explanations that don't make any, really there's no evidence for it, but they take hold like little sparks, right? So we have to nip those in the bud, and we have to keep educating people that we're all responsible for the way we interact with the environment and the way we live our lives, and that we need to reduce this risk overall. And if we could do that, I think we're much better off getting over this outbreak and future ones as well.
I'll note that I've seen a number of public health leaders in this country and others call this out early. And I think it's really, again, to the collectivist response, we should be calling it out in the same way that we would a wolf whistle on the bus. It's part of all of our job to undermine the safety of everybody in our society.
But it's a good question, because there's a lot of subtle racism, kind of coded racism in the discussions, both by politicians, but even in the media. You see lots of talk about people eating weird food, like that. Who are these people who are eating weird food? I think you're absolutely right. That has to be called out. for what it is. And I don't see a lot of that, unfortunately. I've seen, media panels where people talk about people eating weird food, and no one on the panel calls it out. And I think we can do a lot more of that. There's a lot of that. So,
we have a couple of questions from the online audience. So, how can our healthcare systems, most of which operate at overcapacity, prepare for taking over care for an increasing number of cases? Hallway medicine will not be a safe option, yet it persists. And why are we not seeing more aggressive investments by the government to offer infrastructure that can support our hospitals and clinics to embrace a preventative approach and to demonstrate preparedness?
See if we can build a hospital in 6 days.
That's a great question. People are working extraordinarily hard, people on this panel included, to make sure that hospitals are ready. We've divided into stuff, space, and staff. Do we have stuff, all the ventilators and masks? Do we have space to put these patients, and do we have people to work? All of those things are being worked on. Do we have enough? We have not been tested yet.
There's a question behind. Yep.
Yeah, so my question is really around sub-Saharan Africa. Are you surprised with the relatively low number of cases that are emerging from sub-Saharan Africa? And the second question would be, given the fragility of the health system in a lot of those countries, are you worried, and how should they be responding?
I'm worried if this virus takes root. It's interesting to say that we need to explain why we've not seen it take root to date. It could be that the patterns of travel and contact have been less dense than the exports from China so far. It could also be, remember, this is a virus with a thin lipid envelope, and if you're talking about a place with a lot of UV light, it's a little, just like summertime, it makes it harder for some viruses to get around. So that could be a factor. But I think as we saw with the challenge in West Africa with the Ebola epidemics, this can be that much worse if our general health infrastructures still needs to be strengthened. So it is a concern. I know WHO is taking a look at it, and several philanthropists have been quite interested in making sure that sub-Saharan Africa is in a better place to respond.
And several countries are, particularly Kenya, and I know others as well, are preparing. I mean, they're really trying to think through preparing for the worst case scenario, what they can do, how they can deal with public information, because as we saw in West Africa with Ebola, that was one of the problems, was mistrust about this.
And the African CDC has probably more experience dealing with outbreaks than the American CDC at this point. So there's a great deal of expertise on the continent right now, and they're working very hard for exactly those reasons. And so, yes, they don't have resources, but they have knowledge and expertise, and I think we should support them with the former.
There was a question over here.
I'd really like to learn more about how this disease is affecting the economy globally, especially regarding how much of it comes from legitimate supply chain disruptions and how much is just fear.
Yeah, great question. The numbers are getting pretty big, aren't they? Well, there's the immediate ones, right, with travel restrictions and people canceling their events and so on. There's these really amazing shutdown of the whole movement of people you're seeing around the world. And then there is that fear factor. So the markets are going crazy, right? Whenever some data comes out and people react and so on. We won't know how much, to be honest, but I think it's going to be pretty unprecedented, the amounts that we're talking about. Some of it will be recoverable because then we'll have the restart of economies again. I think a lot of companies are going to go down and not be able to get up again, so they're going to disappear. I think what this really shows, though, is we've got a global economy that's so interconnected, and we've got these global supply chains and people moving about, and we're all dependent on each other, right, to produce goods and supply things. What do we underpin that with when this sort of event happens? Everything kind of, it's happened so quickly. It's quite remarkable how quickly the system has kind of collapsed, right? And so that's a time to reflect on what do big companies need to invest in. They need to pay their taxes. They need to pay their taxes so that countries can create public health systems that when these things happen, can be more resilient and more able to recover. And that's good for business, right? So I think a lot of these lessons that people can say in a long time, but that this is going to bring it really to the fore. Maybe we have to have this kind of event to show that why taxes are important. It's not a bad word. Why companies, the public and the private sector need to work together. I think that is really the lesson that I would like people to see.
In terms of global economic impacts, clearly China's position in the global supply chain has had an impact. And some of the recent data coming out of China is at the end of February, the Manufacturing Purchasing Managers Index, the PMI index, came out at 35.7 for manufacturing, which is a record low and lower than during the global financial crisis, and 29.6 for services, when both of these readings had basically hovered around 59 and 54. So we're talking about a 20-point drop in PMI, which is no surprise that Xi Jinping is now saying, go back to work, open the factories. And there's this balancing question about economic well-being and health well-being, and I don't know the answers, but that's an issue. Also, job losses are, their economist intelligence unit forecasts job losses in China alone could raise as high as 4.5 million job losses. So the question is, how do you deal with that? The economist is also suggesting that China's GDP may drop by 4 to 5% quarter on quarter based on those February PMI readings. That could result in an annual change falling from 6% in fourth quarter 2019 to 0. And that kind of impact in China is not going to go unnoticed in Canada and other countries that depend on that supply chain. So I think the potential for international disruption is fairly serious. The other thing I would say is, if we think of China, but we also think of the United States, and the United States has been engaged in something that they call a trade war. I'm not sure who's helped at all, but it's created a lot of impediment to responding collaboratively to what is a global crisis. And when we see what's happening in 1600, I worry about whether the precedents that have been set in the trade war era with China, between the U.S. and China, are going to continue, and much of the rhetoric we hear from the president is kind of along those lines. So I think it's going to be serious, and that's just on the China side and the U.S. side. So think about that globally. I think all countries in the world need to be preparing for a global downturn, and people talk about recession, and there are many people that I've talked to who think that's basically a foregone conclusion, and it's only a question of when it is. So I think it is going to be very, very serious, and that means people in Canada are going to lose jobs. And the people in Canada who are losing jobs are going to be often the most vulnerable and so on. So again, it gets to the question of what kind of society do we want to have coming out of this, and that economic piece complicates it.
The root of your question was, is it fear? And it's interesting the different responses of governments around the world. We're seeing some say, well, we'll cut taxes and we'll drop interest rates. People are not failing to spend because they can't afford it right now. They're failing to spend because they're afraid to get on that plane. They might be afraid to go to market. And so the central bankers aren't used to dealing with this. It is a fear issue. That is at the heart of it to a certain extent. I think the Canadian federal government response announced this morning gets to a somewhat more measured approach to the idea of trying to have some wage continuation to help allow small businesses to survive a short-term shock, that kind of thing. And we need to make sure that the nature of this fiscal crisis is understood. It's not like other fiscal crises because people's motivations are different than other crises.
Question back there?
Is there any plus side with respect to the relationship between Canada and China in all of this?
I think yes, and relations with Canada and China have been not great lately. They weren't great before Meng Wanzhou was detained. They weren't great then. They were all sorts of problems with them, but the Meng Wanzhou matter has created a serious problem there, and really things were in sort of deep freeze. But what's happened here is that you have Canada and China actually agreeing on something, and miracle of miracles, it's a human rights issue. So there is really the possibility, and it has to be handled obviously carefully, and a lot of unknowns and all that, but there is an opportunity for both Canada and China to start working to rebuild that relationship based on cooperation around the COVID-19. It's about community health clinics, it's about dissemination of information, it's about all those things that there can be potentially, and maybe I'm just overly optimistic about it, but I think there is an opportunity there to try to reorient the Canada-China relationship based on common interests in regard to the global response to COVID-19.
Are there any more questions from the streaming audience?
No.
Okay, so I think we're going to give you the last question.
In the last crisis, at least in China, we've seen an increased use of technology. I guess it's AI technology to detect the spread of the disease, and maybe technology has also been used in science to understand how the virus spreads and do some kind of genetic analysis. So the question here too, whether this technology poses a risk in terms of privacy or the rise of authoritarianism, and is there a way of the countries coming together to manage it, to manage technology in a responsible way to promote global health?
Well, technology is neutral. It's how people use it. I will say a positive thing about the contrast between this event and SARS with respect to Chinese technology and capacity. With SARS, there really wasn't a lot on the ground in terms of disease control operations or viral or microbial genomics capability. That has been built. After they observed that places like BC CDC had a bit more success with SARS than other places in 2003, we had many visits and bilateral trips across the Pacific, and you now see a network of Centers for Disease Control. You've got tons of excellent viral genomic capacity in China, and it didn't surprise me that they were capable of finding the virus, posting the genome in pretty well record time. So that investment paid off, but I think you're talking about a broader cross-section of technologies, and I'll leave the dark side of AI to my colleagues.
Yeah, I mean, there's been reports of using AI to track infected or recovered people in China, and there's this kind of concern that this is going to open up all sorts of privacy issues and so on. Technology is, there's so many opportunities to harness the capacities that we have. A lot of it is, as described, coming on stream and being used, whole genome sequencing, for example. What we don't have, though, is kind of like agreements on how they're going to be used and the kind of limits, and also the way that we share this information. So yes, we have had some sharing, and that was very quick. But this is usually voluntary. It's not like it's required to be shared, so we kind of depend on people's goodwill. So that may be one area where there needs to be better governance, because that underpins understanding an outbreak, the pathogen, how it's mutating, for example, how it's changing, how it's moving through populations. That's the starting point for any action on the public health sense. So that seems to be a no-brainer when it comes to creating some sort of agreed global system of sharing that kind of information. We have some of it, we didn't have all of it, and we didn't have it at the right time. So there's still some improvements. The other technologies I think are exciting, but I think we do need to work, be careful about how those are being used.
So thank you for that question, and thank you for all of the questions, and especially thank you to all of the panelists. This has been, I think, really enlightening, not too scary. I was told before by several people, colleagues, like, Yeah, Peter, don't scare everybody. You didn't scare everybody, which is great. I think it was just the right kind of measured response, sort of thoughtful reflection about what's going on. Wash your hands. I can't remember the rest of the poem, but I don't have to say it.
We'll put it up on YouTube.
Yeah, put it up on YouTube. So join me in thanking our panelists. And I want to call up Professor Max Cameron to say some final words. Sure.
My name is Max Cameron. I'm the acting director of the School of Public Policy and Global Affairs, and on behalf of the school, just want to thank all of you, to thank Peter in particular for moderating this excellent panel, to thank the panelists for coming and sharing their knowledge and wisdom, and to thank the team in particular who put this together, organized the online viewing, and brought us all together in this room and managed the logistics of that. I think this has been an extraordinarily timely and interesting event. I want to ask how many of you over the last little while have been trying to make decisions about do I fly, do I stock up on more stuff, do I stop going to big events, maybe? A lot of us, right? And so I really think that as we do that, we find ourselves in a moment of real uncertainty. But there is a good on the horizon that we look to, which is a global response to, as much as possible, get through this pandemic with the minimum of losses. And as we do that, I think the words of, I think it was informed reflection, something that is informed reflection, I think is what Pittman said. I think it's very helpful. We want to try to steer a path between panic, overreacting, and complacency or underreacting. And I think that we're all confronting this as individuals, and our institutions are confronting it. And I just hope that an event like this helps us all together to manage our way through this process. It's a great opportunity for us also to build the relationship between the School of Public Policy and Global Affairs and the School of Population and Public Health. I hope that this is the first of many events that we organize. I hope you've enjoyed it, and I hope that you'll come to future events that we put on. Thank you very much.